We'll move on to our next category of questions, which is on the medical queries for the COVID-19 vaccines. And for this, we received many questions and we have bundled them into a few categories. The first categories would be on how to understand the vaccines. And I think the best person to take our questions will be Dr. Alvin Lee. So Dr. Lee, please.
Yep. Thank you, Sharon. I hope everybody can hear me clearly. So I think as per most engagements that I've been to, I think, and I think more clearly this particular one, I think the queries tend to revolve around three main areas. So one really is the safety of the vaccines. That's one. Second is whether the person can be vaccinated or not. And this will cover a whole list of conditions and medications and what have you. And the third one really is the side effects, in particular, the long-term side effect profiles. And the organizer has a very nicely grouped them into three buckets, which I will address them. But unfortunately, like what Sharon has mentioned earlier, I is unable to go into very, very specific conditions because there's just too many conditions. But what I will do is, one, share a bit about the background first, then the general principles, and then hopefully, if it address your specific question, and like what Sharon has mentioned, if there is still no clarity as to the very, 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 very specific condition and query that you may have, then the suggestion really is to ask the healthcare practitioner, a doctor, whether it's a regular one or other doctor that you may have it in mind. All right, so with that in mind, let's go on to the first set of questions first, which is really about the safety profile of the vaccine itself. But I think the first question here to address in this particular slide really talks about the general public health consideration as to why we want children to be vaccinated. And true, I've also noticed a few points has been raised in the chat group that really is children who actually get, or rather the youths who are infected with the virus tend to get very mild, no signs and symptoms, and they recover very quickly. Then why is there a need to actually vaccinate them? I think from the broader public health aspect, we consider vaccination as has two main effects. Of course, the first one is really protection against the vaccinated, himself or herself. All right, and we know that it reduces the incidence of severe infection. Of course, in this case, we're talking about like the young population, which is not common. But still, it confers some protection. And the next effect of vaccination that we want to consider really is how it protects the people around the person who is vaccinated. And here we're talking about people who cannot be vaccinated for various reasons. Clearly, one of it is medical reasons, and it's and vaccination does confer prevention to some degree, okay, of onward progression of the disease. And we know that children, well, arguably, children, it's a little bit more challenging to get them to obey or to follow social distancing rules. All right, it's a little bit more difficult. And in a school scenario where there's a lot of children mingling with one another, you do want to make sure that these things, one, do not spread amongst children to children. And second, when they're in the school or in the family, not to spread from the children to the teachers or the children to the family members themselves. And if you've been following the reports recently, we realized that especially for the current strain, which is from India in particular, the transmissibility is actually very, very high. And we do have incidents of household members being infected because of one case, one infected case. And therefore, we do want to make sure that infection or spread of infection rather within family members actually gets minimized as much as possible. So in this case, we do see that it's not so, well, there is value still to protect the vaccinated, in other words, the children or the youths, But more importantly, we want to stop or reduce this transmission of infection amongst the people around the person who's vaccinated. All right, and therefore it is actually quite important, not just for the person, but the surroundings where the children is actually in at the school or at home most of the time. All right, so that's really from the public health aspect and some medical perspective of why we want to vaccinate children. All right, and the next group here, it's about the safety of the vaccines. And perhaps here I could just share a little bit about how vaccines are typically produced and why we think that it's actually safe. So for those who have actually been following medical news, we realize that probably vaccines takes years and it's like decades to produce. And this particular vaccine, in particular, we're talking about the 2 mRNA vaccines that have been approved by the Singapore government so far, took about a year or even shorter to be produced and marketed and be approved or provisional or wise, depending on the jurisdiction you're in. And why is this so? Okay, so to answer that question, really, we talk about 2 things. So one, of course, we have the vaccination. As in any other drugs, medications, there are various stages. So one is the phase 0, phase 1, phase 2, and phase 3 trials. And of course, in the production itself. Here, we're talking about 2 key things. So one, of course, is resources. Okay, resource in terms of money, essentially money and manpower. And 2, you do need people to participate in the trials. All right. So in this case, when we're talking about the vaccine, we're talking about COVID-19 itself. We know that this is a pandemic. In other words, it affects many countries, if not all countries, most countries, if not all countries. That's one. And from that perspective, governments, public sector, private sector has been very, very keen to pour in resources to create a vaccine. So there's a very concerted international effort to make sure that something comes out. That's one. And now if you consider that the disease itself is actually quite prevalent in many, many countries, and therefore there is actually no shortage, all right, to get people to volunteer to participate in trials, in the various trials, the different trial phases itself. And if you combine these 2 together, then it is actually quite understandable why for this particular vaccine, the 2 mRNA vaccine itself, that they are able to be marketed very, very quickly, much faster than the vaccine that we have previously. All right. And of course, the concern here is really the mRNA technology. Part of it will come a bit later, about the safety of mRNA vaccines versus the other so-called more traditional vaccines that we're talking about right now. I will just talk a little bit more about, of the mRNA vaccine, and I'll leave the rest, the later slide, a bit subsequently. So about mRNA vaccine itself, the technology isn't new. All right, the technology isn't new itself. It has the technology, the mRNA technology has been in the market or in place for the past decade or so. So the technology itself isn't new. What is new is that it is being used for the first time in vaccine. So that is what I will submit for now. All right. So there may be concerns about the hesitancy to use the Moderna as well as the Pfizer, which use this technology. Okay, but if I can assure you, mRNA technology isn't new. It has been in place for the past decade. I will talk about the other concerns about this particular type of vaccines a little bit later. All right. The studies so far, I'll talk about some of the pivotal studies. We're talking about the range of about a few tens to hundreds of thousands of people, of which a population of which are children or youths between, say, 13 to 16, thereabout. And so far, other than the few conditions that I will highlight a bit later, generally there is actually no other major severe adverse reaction actually noted within the children's subpopulation. All right, so from that perspective, we are convinced that the vaccination, or rather these 2, rather Pfizer for now, is actually safe for children age, for this particular age group that we're actually rolling out for. And just to add on to, or perhaps just a cover statement, is that vaccination is essentially, or rather this vaccine for rather is actually an evolving field, and which is why you realize that at the first, when we first rolled out, at least in Singapore, we only limited to the adult population, and the side effect and the eligibility criteria, which we'll cover a bit later, is rather strict. Okay, there are a lot of people whom we actually exclude. But as more and more evidence are being surfaced, and these trials are ongoing still, okay, one of the conditions by which HSA allow is that vaccine companies need to continuously supply data, research data, to the government to continually assess the safety and the efficacy profile of the vaccines itself. So it is not a done deal where once we approve and that's the end of the story. So information is being fed to provided to the government on a continuous basis, which is why the age group has been expanded from the adult population to the youth population, which we see right now, and also from the contraindications, the medical condition has also been expanded significantly since the start of vaccination late last year. And these will continue to evolve if we see more and more information. So if I can just bring the parents here and all participants here to one of the questions that was actually raised earlier, why not all school children? As what was mentioned, explained earlier, this is really due to what is available, safety information and efficacy information for the vaccines right now. And there is certainly no stopping us to expand this even further to all school-going children if the evidence that comes out to us actually prove that it is safe and it is efficacious. All right, so this is an evolving field right now, and do stay, keep a tight watch on the media. We are certainly going to publish this, or rather announce this as and when new information is surfaced. All right. And then the last question here in this particular slide here, we talk about HPV vaccine, and I'll probably just broaden this question, as I understand that for parents out there, you're certainly aware that there's a certain immunization schedule to go through. All right, at various stages of their schooling career, and it's not just HPV itself. And the general consideration that we have here is that the duration between two vaccines, any two vaccines, and this is not really limited to just COVID-19 plus something else, but any two vaccines, the general recommendation here is actually a gap of 2 weeks. All right, so long as that's the period or duration between two vaccines, any two vaccines is outside the 2 weeks interval, generally it is considered safe. All right, so I hope this gives some broad overview and to allay some of the concerns regarding the safety profile of the vaccines itself and the some of the more public health aspect of vaccination amongst children.
Thanks very much, Dr. Lee. I think it was very useful for us to understand more about how the vaccines are produced and the details about it. And it was also very meaningful to remember that vaccination is important, not just for the person, but also for the people around. Yeah. Another set of medical questions that are on many people's minds is really about side effects. And I think many parents are very concerned about side effects and the impact on the growth of their children, if any. We received these questions before the session, and during our Q&A chat right now, there are also many parents who have surfaced these questions. So I think it'll be very useful for us to share your thoughts on this.
Yeah, sure. Thanks, Sharon. So the next set of questions really talks about the side effects of vaccination, which is clearly which is really the concern, and of course with recent media coverage of course the myocarditis. And I think I had a quick glimpse. Someone mentioned about depression and psychiatric conditions. I will address both in a short while in this particular section right here. Okay, but I'll also start this section by highlighting something general first, which is that these side effect profiles of this particular vaccine is in general not much different from those in the adult group, all right, with the same vaccine, which is really not much different from the side effect profile of most other vaccines. All right, so the side effect profile, in other words, the side effect profile of this vaccine in this particular subgroup is not much different compared to any other vaccines itself. All right, so we're talking mostly about a localized side effect, so hand swelling, arm pain, and for those adults, for those parents who have actually undergone the vaccination, the COVID-19 vaccine itself, will probably experience this. I mean, myself, who have taken the vaccine, essentially experienced pain or soreness over my injection site, as well as very, 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 very mild lethargy. All right, and the side effects I experienced with my first and the second jab is no difference. All right, but you've also heard stories about our anecdotes about people who have stronger side effects after the second dose, and this is also true for children as well. So no different again from the adult population. All right, and similar to the adult population, the side effects do last a few days, and probably most about a week or so. In other words, should the side effect persist, like fever, do seek medical advice. It may or may not be due to the vaccine itself. All right, and certainly I do need to remind all the participants here today that the full effect of the vaccine is only realized 2 weeks after the second dose. All right. In other words, it is, and of course, with the recent clusters will also have reminded us that vaccines are not 100%, and those who are vaccinated can still get infected, except that the severity is actually much, 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 much reduced. All right. So please bear that in mind, and from that perspective, do seek medical attention if the side effects do last beyond a week. All right. Now, the next thing about side effect is really about long-term side effects. Of course, things like puberty, like growth, and other various things. And I will be honest and frank with the parents right here, or the participants here, that if you're looking at side effect profiles, long-term side effect profiles in the range of 20, 30 years, then quite clearly we don't have, because this is only in the market for about more than a year thereabout. Okay, so we're talking about side effects in the range of done over a period of a year, more than a year rather, and over a group of 400,000 plus 500,000 people in various studies. And based on these studies so far, there has been no indication that it has affected puberty or growth. All right. Of course, again, I do have to repeat that long term, in the range of 20, 30 years, we do have to wait and see. All right. I think there's really no point hiding it. All right. Now, of course, the recent reports point to two particular conditions. One, of course, is myocarditis, and the other one is about depression. Myocarditis clearly is in the mind of most parents, because it was just announced yesterday, and I see a lot of questions posted on the Q&A. Now, I just need to put this in perspective first. Yes, there has been cases, but just to clarify, the link has not been established yet. All right, it's a probable link. Both US and Israel are actually studying right now. Now, that aside, all right, we have to understand that the figures that was actually posted by Israel was about 275 over more than 5 million being vaccinated. And therefore, we're looking at a percentage of about 0.0055%. Now, and this quite clearly is actually quite a very, very small percentage. Now, two things we take away from here. So one, of course, if in the, of course, 0.0055 doesn't mean 0%, and therefore there is still a possibility. Yes, I will not deny that, but the treatment is actually adequate, and actually most people do recover after treatment. All right. I saw questions regarding about signs and symptoms about myocarditis. Unfortunately, it's not very, very specific. There is the occasional chest pain, but otherwise, we're talking about fever and shortness of breath, which are actually very, very non-specific. In other words, if the symptoms actually do persist beyond the 1 week duration, do seek medical attention. But context here is it is extremely rare. We're talking about 275 over 5 million people who are vaccinated. So that's one. All right. Second one, it goes to a bit more technical part, which is about what does this 0.005 actually mean in the first place? Very broadly, there will be people, even without being vaccinated, will have myocarditis for various other reasons. Okay, not just vaccination itself. And therefore, we do need to understand whether this percentage we're looking at right now, is above what we see prior to vaccination. All right. And if the rates are actually the same, then the link may not be that clear cut. And indeed, the link is not established right now. There seems to be a relationship, but it has not been established yet. And in general, when we talk about side effect profiles of medications, which include vaccines, we do have to understand that there will be side effects, even from your very, very friendly Panadol that you take. The question that we do need to answer here, and you probably hear it in the media quite frequently, and certainly the EU has been talking about this in the wake of J&J and AstraZeneca vaccines, is that whether the benefits outweighs the risk. Okay, that is a very, very important question that we need to ask ourselves. Because no medications, including vaccines, are 100% safe. We do not guarantee that. And no pharmaceutical company can guarantee that as well. And therefore, the key question we do need to ask ourselves is whether the benefits outweigh the risk. And at this point of time, yes, we think it is. All right. Now, the second set of medical conditions that have been raised and brought up by at least one parent that I've seen in the Q&A earlier is the psychiatric conditions arising from the vaccine itself. So again, we are seeing a very, very extremely small number of youths who had so-called increase in severity of their psychiatric condition. Now, this again needs to be seen in perspective. One is that the people who actually the cases reported actually just started on a new medication, and for those who actually take medications for various chronic condition would understand that the start of taking a new medication is actually quite critical in the sense that we need to find the correct dose. Too much medication, side effects becomes difficult to manage. Too little medication, too little dose, there'll be no effect being derived from medication itself. And the medications that these people take, unfortunately, are linked to increase in severity of the psychiatric condition. All right. So what I'm trying to say here is that the association, the so-called association that we see right here is actually complicated by the fact that they have started new medications, they are ongoing conditions, they are unstabilized conditions, and therefore to say definitively that the vaccine causes increase in severity of the underlying psychiatric condition, again, is very, very premature at this point in time. And I do understand that within the professional circle, the College of Psychiatry actually has come out to say, I don't think it's published yet, I think, that the link between the cases that have been described right now cannot be definitively linked to vaccination itself. All right. So from this, so my point in explaining these two conditions is that number one, look at the headlines with perspective. All right. At the end of the day, we are concerned with the benefits versus the risk, and certainly we will not recommend any vaccines if the risk is too much to bear. All right. So that's about side effects, to address some of the recent concerns about the reports that are coming out in the media right now. Now, I remember talking about the DNA vaccine in the earlier slide and the safety profile of DNA vaccine. So this is the second part of the DNA vaccine itself, whether it affects the immune system. All right. So to put it hopefully as simple as possible, this we see here is the genetic material or our genetic material stored as DNA in the body. And the technology that we're using right now for the two vaccines that have been approved so far are actually RNA in nature. Okay, specifically mRNA or messenger RNA. And this particular RNA does not change and become DNA and get slaughtered, however you want to put it, slaughtered into the human DNA itself. And therefore, it does not disrupt the immune system. All right. In fact, the lifespan, well, if we can call it lifespan, of this particular RNA vaccine is extremely short, and we're actually talking about the range of just 2 days. Okay, and within 2 days, the RNA or the mRNA will get destroyed by the body itself. All right. So from these two perspectives, I also want to assure that RNA itself, from what we understand about the science and the studies related to the vaccine itself, is actually safe. It does not get introduced into the body DNA system, and at this point in time, we certainly do not think that they will cause any problems with the immune system and and other effects. All right. Yeah.
Thanks so much, Dr. Lee, for the detailed explanation. This brings us to the next bunch of questions that many have about medical eligibility. I think parents want to know what would be suitable for their child or not because of the existing medical conditions. Yeah.
Yep, correct. So this third group of questions really is really about a whole bundle list of medical conditions, medications, treatment, and all sorts. And this is where I really wish to appeal to the parents that I will not be able to run through all your 529 questions, 530 right now, all the conditions that you actually listed. Okay, so in this particular segment, I do need to explain from the perspective of general principles. All right. In general, like the adult population, all right, this is similar to the adult population. Most medical conditions, most medical conditions are not contraindications to vaccination. In other words, most people can be vaccinated. All right, most people can be vaccinated. We're only concerned with a couple of groups. Okay, one of which is allergic reaction. And we're talking about severe allergic reactions to any previous vaccines. Severe allergic reactions to any products. Okay, so I'm quite sure in the list right now there will be fishes, there'll be shellfish, there'll be prawns, there'll be penicillin, there'll be peanuts, there'll be eggs, and a whole lot of others. All right. Okay, so we are not concerned with the specific thing that the person is allergic to. All right. So even if you tell me eggs can or not, it will be the same answer for me. So it's not so much of what the person is allergic to, but what the reaction is. All right. If it amounts to anaphylaxis, or we call severe allergic reaction, the answer is no vaccine for now. All right. And again, what is severe allergic reaction? This is defined by meeting two of the three criteria. If you cannot remember, it's actually okay, because the moment you actually make the appointment on the IT system, this question will be flashed out, and you will know. All right. But essentially, we're talking about meeting two of the three criteria. So one, skin manifestation, either swelling of the eyes, swelling of the nose, swelling of the mouth, swelling of the lips, not all rashes all over. Okay, skin sign, number one. Second criteria, breathlessness. Okay, shortness of breath. Second criteria. The third criteria is signs suggestive of a drop in blood pressure. the most common, the one we put on the system is dizziness. All right, so when they have actually not enough, like for example, blood circulating in the blood vessels itself, the person actually can get dizzy, and this actually leads to shock. All right, and these three, meeting any two of the three criteria suggests a severe allergic reaction, and this is a no-go for the vaccination. All right. I have to say that these criteria is actually being reviewed right now by the expert committee, and I think in a couple of weeks' time, they may come up with a new set of criteria based on, again, like I said earlier, as an evolving area, based on what is actually released so far. This may actually be relaxed. For example, that pregnant women can now take the vaccine. All right, so this is an evolving area. So that's one. And of course, if there is previous allergy, not just severe allergy, but just allergy to other vaccines earlier, and this I'm talking about just rashes. Okay, see a specialist, an allergist, to assess the whether the person can actually take the mRNA vaccine itself. So that's the second group of people who with regard to eligibility criteria. And of course, then the whole list of medical conditions now. Medical conditions, I will just broadly talk about how we decide whether it's yes or no. So essentially, we're concerned with people whose condition, either condition itself or treatment, all right, results in a drop in immunity. All right. Okay, so in other words, you can probably imagine people, for example, on active cancer treatment. All right, people who are on, say, for example, chronic steroids, recent transplant, and things like that. All right, so conditions or treatment that results in a severe drop in immunity for now, and for the mRNA vaccines, we are suggesting that they do not take the vaccine. And the reason is not so much that the vaccine can harm the person. Okay, the reason is because of the nature of vaccination itself. Now, the principle of vaccination is such that when something gets injected into the body must be able to produce antibodies. Otherwise, there's really no point vaccinating. So for people with very, very poor immune system, the thinking, at least from within the local circle, is that there is insufficient, the body cannot produce sufficient antibodies. All right, and as a result, the vaccine is wasted. All right, so it's not so much of the fact that the body will harm the people who have poor immunity, but because the body cannot mount sufficient response and therefore cannot give the protection that is actually required. All right, so please bear that in mind. Again, this criteria will be revised. And in fact, I understand 2 days ago, okay, for those patients who are undergoing active cancer treatment, they can actually be vaccinated already. All right, and again, proof to the fact that the issue is not so much of the safety of the vaccine itself, but because of the reaction, the ability to mount a relevant, suitable immune response. There are caveats to this. You need to discuss with the oncologist, but otherwise, the thinking is that it is generally safe for these groups to take as well. All right. So in other words, conditions like asthma, allergies to milk and peanut, asthma itself, hyperthyroidism, and many other conditions actually listed, I'm quite sure in the Q&A itself. The answer is yes, they can be taken. Okay, so because the treatment of these two conditions, as at least on this particular slide, do not lead to a very systemic drop in the immunity itself, and certainly not carbimazole. And as for allergic to milk and peanuts, again, like I said earlier, it is not so much of whether the person, the product itself, what the person is allergic to, but really about what the reaction is, okay, after taking these offending agents. All right, so I hope that this broad principle can help you understand about your very specific medical condition that you or your child or children, for that matter, may have and decide. And I said earlier, if you're unsure, there are two things you can actually do. So one, of course, you can actually ask the doctor. Or second, you can just go to the electronic system and go and make a booking. The eligibility criteria is actually in the IT system itself. And if you actually meet any of the criteria to contraindication for that matter, there will be no, you will not be allowed to complete the booking process. Okay, so there is an inbuilt check itself. And again, if you still have lingering concerns despite the system allowing you, the doctor is on site in the vaccination center, you can ask him or her too. And just to share a little bit of the other work I do in this particular vaccination, in some cases, we do understand that the medical condition can be a little bit complex. And therefore, the vaccination centers do have a direct link with the Ministry of Health, and these questions do get surfaced to us. And I'm one of the doctors who's actually looking at these questions as well. All right, so there is a chain that's going on. So there is no, you can ask if you're unsure, all the way to the vaccination center. All right, I hope that's clear enough about the medical eligibility. I just want to repeat that this is an evolving field. As we know, as you gather more and more information, we will adjust the criteria as necessary. Yes.
Thanks so much, Dr. Lee. We really appreciate the details. I think it helps lay people like us understand it a lot more. And for all our attendees in the chat function, we have also put the links for MOH, more information on MOH regarding your vaccination, etc., and the FAQs. I think this will give you time to refer to it and to understand this better.